Next topic for the day is basic tools in childhood behavior. The chairperson for this topic is Dr. K.U. Suresh Balan sir, and the speaker is Dr. Suchit Tamboli sir. We request Suresh Balan sir and Suchit Tamboli sir to occupy the dais, please.
For child behavior, as we know that we had extensive talk on child behavior. So behavior is a very important part of growth and development of any child. And as we all know that there are various types of behavior, good and bad behavior in children. So we have to, as a pediatrician or as a caregiver, we have to be in a position to guide children, and we should have the sufficient knowledge as to how to follow up the children, whether they are going in a proper direction or not. These few words I like to advise the speaker to take over.
Thank you, sir. Thank you, sir. At the outset, I must thanks the organizer for giving me this opportunity to talk on basic tools in childhood behavior. And this is very interesting topic because in our practice, what tools to be used in the for the diagnosis as well as for the management and progress of the child behavioral problems that we should we are going to see. So what is behavior? Behavior is how someone acts, or it is what person does to make something happen, to make something change, or to keep things the same. So behavior is a response to things that are happening. So it is affected by either internally by the thoughts and feelings, or externally by the environment or the people who are included in the environment. So behavioral assessment tools are tools that measure and analyze the person's behavior and personality traits, and these tools are commonly used in the school as well as in the child development clinic to help identify an individual's strength as well as weaknesses. So behavioral assessment, when we go for the behavioral assessment, it should be detailed process to help formulate accurate diagnosis. Then they typically require parent interview. This is very important because parent interview if we take, then we will come to know what are the problems child is facing. So parent interview to obtain developmental history, diagnostic questionnaire, teacher interview, and or school observation and a clinical session with the child. So actually, what is the purpose of psychological assessment? It should be goal driven for diagnosis, therapeutic as well as progress evaluation. So three things we are going to see with the due to the psychological assessment. And the test which are used commonly, like intelligence academic skill test, or neurocognitive skill, motor skill, or behavioral and emotional functioning. So all these tests, they quantify the child's functioning, and that is very important. So quantification of the child's functioning is important. So what are the types of assessment? Like norm reference test, interviews, observation, informal assessment, and actually non-form test. So what are variables? Either it can be a reactive affect, so assessment procedure affect response are there, or examiner to examinee variable are there. So research suggests that the children of low socioeconomic status and ethnic minority are more affected by the examiner's characteristic. Then what are the tips to use behavioral tools in the pediatric practice? So first, very important is that you have to identify the target behavior. So what is the specific behavior that you want to change? So be specific as possible. So for example, instead of saying I want my child to do better behaved, say that I want my child to stop hitting his sister. Set clear and measurable goals. So what you want to see happen instead of the target behavior. For example, instead of saying I want my child to be less aggressive, say that I want my child to use his words when he is angry. So such type of specific identification of the behavior is very important. Target behavior. Choose the right behavioral tool. So there are many different behavioral tools available, such as positive reinforcement, timeout technique, token economy. We have seen in the last discussion also, and it depends upon the child's age, means developmental level and the specific behavior you are trying to change. Most important thing is that be consistent. So behavioral tool work best when they are used consistently. This means that using the behavior every time the target behavior occurs, and be patient. It takes time for the children to learn new behavior. So then don't get discouraged if your child doesn't see results immediately. So you should not be in a hurry that, okay, I have given this therapy and my child is now normal. So this doesn't happen. So you have to wait for the results and just be patient. So and be consistent, that same tool should be applied when same type of behavior occurs. Then positive reinforcement involves rewarding the child for good behavior. So rewards can be anything, like whatever the child enjoys, like praise, stickers or special activities. Then timeout technique, this involves removing the child from a situation when they are misbehaving. So timeout should be used in a calm and consistent way. So suppose some child is very stubborn and they are throwing the things away and everything. So like that, when a child is misbehaving, just do not do anything, ignore that child. So that is timeout technique, and it should be used in a calm and consistent way. Then token economy, here it involves giving tokens for the good behavior and it can be exchanged for the rewards at a later time. So that is again very important. So how tools can be used in the pediatric practice is that like in ADHD, token economy system helps them to stay on the task and complete their work. In ASD, it may benefit from social skill training. So that is important. Now we will see which type of behavioral tools to be used for the which according to the age group. So for infant to toddler, that is 0 to 3 years, we can use positive reinforcement. Then distraction. What is distraction? If the child is starting with misbehaving, then try distracting them from something else, such as toy, song or game. And timeout we have seen already. So for toddler, short timeout self-place can be effective, but it is important that timeout never should be used as a punishment. That is important. So the guilty feeling should not be there in the children. Then for 3 to 5 years, positive reinforcement, distraction as well as timeout technique. So then again for the school age children, here the significance is different, like positive reinforcement when you are going to give like praise stickers or other small rewards. These older children appreciate more meaningful rewards such as extra screen time or special privileges. So such type of things they appreciate more. And token economy, again we have seen that they earn token for good behavior and exchange token for the reward in a later time. Privileges such as staying up late or choosing what to watch on the TV, or even means actually most important thing is that parents should remove that privileges when the child is misbehaving. So when you are giving privileges when child is behaving good, but you can remove that privileges when child is misbehaving. So that is also very important. Then this is again very important for adolescents age group, that positive reinforcement by avoiding giving rewards that are too materialistic, because adolescents, they are fond of materialistic rewards. So you try to avoid materialistic rewards, and for privileges you can be consistent as going out with the friend or using car, such type of things also can be given. But the most important is that natural consequences, they are logical consequences of a child's behavior. For example, if a child forgets to do their homework, they may get a bad grade. So natural consequences can be very effective way to teach adolescent responsibility as well as accountability, and that is very important. So let them face whatever consequences are there due to their behavior. That is again very important. Then what are the behavioral observation you are going to do? How child relates to the parents, then child relates to the examiner, child reacts to the test material, or is child is age appropriate behavior, and what is the concentration of the child. Then psychological assessment is done, areas like orientation or general appearance or speech and thought assessment is done. And we have seen that behavioral tools for a particular child will depend upon their age, developmental level, specific behavior, and which we are trying to change. So it is important to involve child's parents or caregivers in the process and to get their feedback on the behavioral tools you are using. I think this cognitive behavioral therapy has been discussed in depth in the last session only. So we will not go into the details. Only thing is that in cognitive behavioral therapy, your child can learn to replace negative thought with the positive one and understand the impact of their action on themselves and others. And CBT works best for the children who can self-reflect and talk about their challenges. So in this type of children, CBT is definitely work. Then dialectical behavioral therapy or DBT, it is helpful to manage children with intense emotion, regulate behavior and create meaningful relationship with others. Here concept of mindfulness is very important, and these children actually they if a child feels agitated by a situation, and they may taught calming technique such as deep breathing or counting. So actually our grandmother tells us that whenever you are getting angry, just go on counting the things, but we were not aware about that very good thing. But when USA people started 6 seconds, then we were very happy that hey, okay, 6 seconds is very good for controlling the emotions. But that we have in our culture, and that we should know. So deep breathing and counting is again very good therapy for that agitation or anger. Then behavioral activation therapy. What is behavioral activation therapy? It is a great tool dealing with the depression or anxiety. So it is based on the theory that if someone is struggling emotionally, engage them in a positive activity that can improve their mindset. So that is the theory which is behind this behavioral activation therapy. Then child-centered play therapy. Here we use toys to act out scenes from their everyday life, and this allows them to practice healthy coping skill and create a sense of control over their emotion. So here that is very important, that therapist should help the child to process the trauma, build self-esteem and develop problem solving skill. So this type of therapy works best with the children who have a rich imagination and can express their feelings through the play. Then family therapy. Here better parenting technique and support for sibling of children, family members to communicate their needs and safe and supportive way. Then again applied behavior analysis. This is again very important technique, especially we are using it for autism children, ABA therapy. There are workshops for ABA for parents as well as for the pediatrician, and it is a therapy which is scientifically intervention which uses positive rewards to shape and reinforce desired behavior. It is highly beneficial for children with autism since it helps them learn social, verbal and motor skills, and they actually wouldn't pick up the same way as their peers. So ABA aims to help children develop daily living skill, communication, self-management, so that they can be happier, healthier and more independent. So ABA therapist will pay close attention to what happens before and after a problem behavior and work to address things that trigger and reinforce it. Then parent-child interaction therapy. So parent-child interaction therapy, where strengthening the relationship between parent and child and improving parental skill is again very important, and it provides appropriate consequences. Actually, when the child is upset or acting out, how to respond better way, that can be taught in this therapy. Then these are some tests which are used according to the age, like Mullen scale for learning, where we use cognitive, language, motor and social emotional test. Then Bailey scale of infant development for 0 to 3 year age and stage questionnaire for cognitive, language, communication and problem solving skill. Then preschool age group, preschool behavior inventory or Vanderbilt or child behavior checklist. All out of this, around 50 to 80% test, they are available online and free. So you can start using, you will definitely get benefits from the test, because then you are going to diagnose them scientifically and proving that this child is having this problem, like behavior rating for the executive function or Wechsler's intelligence scale. It requires 1.5 hours and it should be given by the psychologist. But there are few screening tests like Beck depression inventory, which we are using in and out and it is a self-reporting rating scale, and it is very good scale for diagnosing of depression in adolescence age group. We are using since long time. And revised children's anxiety and depression scale. Then we are assessing developmental delay, behavioral problem and mental health disorder. So pediatrician use screening test, child psychologist use to diagnose them, mental health professional actually use that behavior rating scale for treatment plan, and therapist also use behavioral assessment tool to track the progress of the child. So all these are important. So screening, diagnosing, treatment plan and treatment monitoring, all these are very important factors for the this thing. So developmental delay, we ask this type of questions, you know all these, so I will not go into the details of this developmental delay. And like behavioral problem, we can ask which type of whether the child is sitting still or not, or child is acting impulsively without any thinking, and does your child worry a lot or child feels sad. So like in case of anxiety or depression, we can ask such questions for the adolescence age group. So behavioral tests which are commonly used for the ADHD are Conners, Vanderbilt, teacher report. Anxiety disorder, again here behavior Beck's inventory or revise inventories. Then this depression, again I have seen, I have already told Beck's depression inventory, autism spectrum disorder, CARS or GARS, such type of test. Now last part of our lecture is that American Association of Pediatrics, AAP, has given compilation of the test, and this is a wonderful test which are charts which are given by the AAP, and they are available on the AAP website also. So just important thing is that actually this process is depicted by the mental health algorithm with the detailed steps and include a toolkit. So several points about the table where nothing. So here see age and stage questionnaire. How many items are there, in which language it is available, how much time it takes, and where it is published or where it is available online. So such type of things they have given. So age and stage questionnaire, pediatric symptom checklist is there, then screening for substance abuse as well as depression. These are very common tests which are used, and if you start using it, you are going to diagnose them. So parent and family target screening, abuse assessment screening, suicide screening test which is ASQ, and like suicidal ideation questionnaire. Such questionnaires are very useful for diagnosing their tendency. And psychiatric illness test, delirium rating scale or severity of psychiatric illness, then behavioral assessment for adaptive and problem behavior, ADHD test we have already seen, behavior and conduct disorder test. We are getting many patients of conduct disorder also, and we are actually, if we diagnose it properly, then we can manage according to the medicine which has been given in the last discussion. Anxiety screening test, speech language, then sleep disorders test. There are substance abuse and sexual behavior assessment test. This is also very important nowadays, that what is the type of sexual behavior the child is having and how we can proceed with that. So CBCL and family centered plan. So now to conclude, behavioral tests are valuable tools that can be used in pediatric practice to screen for, diagnose and treat developmental delay, behavioral problem and mental health disorder. Behavioral test can also be used to monitor the progress of the child who is receiving treatment for a developmental delay or behavioral problem or mental health disorder. So suppose Beck's depression inventory you have given in some depression patient, first time score was 30, then after your medicine and counseling you again give the test, you can see the score has reduced to 20. So you will definitely know that whether you are in a proper line or not. So that is very important. So behavioral test can be administered with a variety of healthcare professional, including pediatrician, child psychologist and other mental health professional. The specific test used will depend upon the child's age, developmental level and specific behavior which you are going to assess. So benefits of using behavioral test in pediatric practice, like early diagnosis and intervention, which is again very important, tailored treatment plans. So it can help in clinician to develop treatment plan which are tailored to the individual need of the child. Monitoring the progress, that is again very important to track the progress of the child who is receiving treatment for a developmental delay and behavioral problems or mental health disorder. Thank you very much for the patient listening. Thanks, sir.
Thank you, sir, for your nice and informative talk on the various tools to use in pediatric practice with regard to behavior. But only one doubt I have is, you showed lot of this tests, sir. Are they available in the regional languages?
Yeah, few of them are available in regional language. Actually, Beck's depression inventory we have translated in Marathi. There are few tests which are available like autism screening test, MChat is available in Hindi. So like that they are
MChat is available, sir, but many of the other tests which you have been telling.
Yeah, there are few tests which are available. Okay. Like anxiety scale is available in Hindi.
No, what about in Tamil? I don't think they
Tamil, I think we can translate
make
that.
a translation
that
and
is
validate it.
Very, and validation should be done.
Thank you, sir. Any questions in the audience?
Thank you, sir. Thank you for such a wonderful presentation. Thank you, sir, for gracefully agreeing to chair the session, sir.